So I just got back home from my trip to the doctor's office, and I couldn't tape much there because I wanted to protect people's privacy, obviously. You know, if there's people in the waiting room, I'm sure they wouldn't like their face all over YouTube or anything. So I was trying to be professional, and sorry I didn't get to show you the waiting room or my conversation with the office staff. However, just trust me, they are very sweet, very nice, and they made me feel reassured and excited. And one of the conversations I had that while in the OR, and I've actually seen this happen so I can understand it, while the surgeon is determining the proper size and the proper fit for you, even if you decided 500 cc's was perfect for you and that's what you wanted, my doctor personally does what he feels is best, because there's this thing called a double crease. If there's not enough room between the nipple and where the bottom crease is of your natural line, so I've decided to try the 350 or 325. If the doctor feels that I'm going to have this double crease, so they put in this spacer. It's like it's sterilized. It's what the actual size of the gel is going to be when they open the package. But they don't want to open a brand new package, a sterile package of the actual size that you're getting until they know for sure that's going to be the size that works for you. So you're in surgery. They cut you open. They put in this spacer or whatever they call it, and to get you fitted for the right size. They put it in. And then they take the table and they push the button. The table rises all the way up. And so that you're actually laying in the bed, but you're up in a standing position, totally knocked out. You don't even know what's going on. And people are touching you and feeling you all up. I'm just kidding. Anyway, so they raise you up in the bed, and they want to see how the implants hang, and if they're in the right position or not, and if you're going to have that double crease or not. So if they do find that that's happening, or maybe they're too wide, or sticking out too wide, or they're over too far, then they will lay you back down. They will try a different size, put those in, and again do the same thing. So in my case, my doctor told me he feared that the 350 cc's would cause this to happen, and if that happened, would he have the permission to just go ahead and put a 300 in me? And I said, absolutely. I trust him. I think that he's going to do exactly what's best for me, because he understands that I'm not there to go super big. I'm not, that's not my profession. That's not what I do for a living. And this is just so for me and my own comfort. I just want to be more proportioned. So he understands that and gets that. And he's going to put in what he feels is exactly what I'm wanting. It's hard to determine that with just the toys that they have you play with in the office, with their bra and the gel implants, the inserts. So they can't really determine the perfect size until they're actually in there working around and moving things. So I like that idea. If your doctor does the same thing, it will make you feel so much better knowing that they're looking out for your best interest. They're not just going to put in the size you want and have it coming out looking terrible. You know, they really do try to fit the right size implant with the size of your body. And everyone's different, so every case is different. I've seen people that are my size get 520 cc's, which for me is like, that is crazy. Like, I would never do that. But some people do. That's their preference. And sometimes their body shape is different, and it looks great on them, and they can handle it. But that's just not for everybody. So anyway, my visit today went very well, and when I got home, I was surprised that my package came in the mail so fast from Amazon. So part of having the abdominoplasty is that you have to wear a special surgical garment for 6 weeks after surgery. Of course, you can take it off, put another one on while the other one's washing, vice versa. So I'll show you what these look like. And I didn't just get the most expensive one I saw online or the best or whatever. I actually just got something that said high compression, and it was actually one of the cheaper ones. So you don't have to spend a ton of money in getting the right garment for after surgery. So this is what it looks like. I got the boy shorts and the tight fitted, and this is braless, so this is going to go up underneath the bra. And I will try this on and show you what it looks like. Okay, so I've got the suit on. As you can see, it's super tight. It makes me look a little skinnier too. Got a little bit of a butt lift, and it goes underneath the bra, just to here. And it's got a nice little opening in case you have to go to the bathroom, but it's all covered. I didn't want to expose too much, but just so you know, that's how these suits work. And it's got a zipper, and it's got hooks. So you secure it with the hooks, and then you zip it up. And I have to stay in this suit for 6 weeks so I can maintain a flat tummy after surgery. Because they said, after they do these types of surgeries, you can get indentations from things that you wear, like your panty line or your pants. So they like this to all be compressed, not just for that reason, the creases and the lines, also for the reason being that after surgery there's a lot of swelling, and compressing the area that holds in that swelling makes the body absorb all that extra fluid back into the body and recirculate it out, so that you're not super huge and bloated and swollen all the time, because that's very painful. So this helps with pain and discomfort. And this is actually a very good fit. So this was true to size. When I did my measurements, I did it exactly how the instructions said to, and I was able to pick out the size I needed, which was a small. And I wanted to make sure it fit in case I needed to send it back and get a new one in a different size. So this worked out well, but I have 2 weeks left still, so I had plenty of time to get that straightened out in case it did work out. So that's one of the parts to pre-prep before surgery.